All right. Welcome, everyone, to our brand new webinar with Dynasty Dermatology. We are here today to guide you through the world of aesthetic treatments. Whether you're a first timer or looking to take your skincare to the next level, this webinar will help you feel confident and informed as you navigate your journey. We do also have a fantastic promotion for you today, so make sure you stay tuned until the end of the webinar and we'll explain how that works. Before we get started, let me introduce you to our wonderful speaker. I'm pleased to introduce Dr. Joanna Chan, who has over 15 years of experience and has studied at Harvard and Stanford. Her and her team at Dynasty Dermatology specialize in cosmetics, medical dermatology, and skin cancer surgery. And they're also open on Saturdays. So without further ado, Dr. Chan, the floor is yours.
Hi, everyone. I wanted to give myself a little introduction also. Let's see here. So, as you all know, my name is Joanna Chan, and I founded Dynasty Dermatology. Many of you are my patients or have seen another provider at our practice, which used to be called Huntington Dermatology. And about 3 years ago, I took over management and have slowly began to acquire devices and offer more treatments for our patients. And I was actually born in Burma, grew up in Texas, went to Harvard, then Stanford Medical School. Then I did my fellowship training in Mohs micrographic surgery, reconstruction, and aesthetics, where I learned how to do advanced cosmetic procedures such as facelifts, eyelid lifts, lipo, chin implants, laser resurfacing. I speak both Mandarin and Spanish. I also speak Taiwanese. And I don't have a ton of hobbies anymore, but we used to have a lot of hobbies. Now I mostly spend time with my boys. My husband jokes that my only hobby now is matchmaking, so that's on there. Anyway, I wanted to kind of start with this picture because it shows us that it took us a while to get to where we are, wherever we are in this journey. It took us decades, right? So it makes sense that it would take also some time and energy and investment to try our best to reverse some of the changes that we see. And it's a big task, and we can turn back the clock and slow down the clock. However, we can never stop the clock. So that's why I want to take time to be intentional and thoughtful about our conversation today, which is very ambitious. But before we get started on that, I wanted to have a poll that Holly has prepared.
All right, so you guys should see the poll here. So go ahead and choose which one of these are your top aesthetic priorities. You can choose one, you can choose multiple, you don't have to choose any, but we just like to get an idea of what we have in common. I see a lot coming in for wrinkles already. Same here. Skin discoloration, okay, sagging skin, hair loss. All right.
And you can vote for more than one.
Yes, you can vote for more than one. Everybody has, maybe more than one condition that they're more concerned with than others. Looks like we have a few more popping in. All right. And I'll share these results as well with everybody. Dr. Chan, go right ahead.
All right. Well, that sounds about what I see in my practice. So wrinkles is number one. Okay, let me close this here. So when you come in to see me for a consultation, I will have an extensive history. We'll ask you lots of questions about what's worked, what hasn't worked, what you've been doing, and most importantly, what matters to you, right? So when you look in a mirror and you see yourself, what are you thinking? What are you feeling? What are other people saying about how you look and how you may appear to feel? Do you feel sad because you don't look sad? Or do you feel happy but you look sad? Or do you look tired but are not? So these are the things we want to talk about during the consultation. And the other thing I like to talk about is timing. Why now? Why are we starting the journey now? Are we continuing it? Are we accelerating it? Is something coming up like a wedding? Are you having any menopausal changes or just had a baby? Are there changes in your job? And then also, what kind of downtime you can afford? Can you take time away from being forward facing? Are you with clients all the time? Or do you have a few days where you can recover? Do you only have a weekend? Do you have a week? And then we also talk about cost benefit analysis, right? What kind of procedure would be the best bang for your buck? What would be the most impactful intervention? And then also a timeline for that procedure, as well as whether we need to calendar different things to help synergize the results that you might get with the one procedure to begin with. We'll also talk about your risk and pain tolerance because if you're the kind of person that just wants to learn and dip your toe in and maybe talk about skincare, that is definitely a great first step. Or are you the kind of person who's ready to go and wants some major impactful visual changes that you can actually see and appreciate pretty quickly? So these are all things that we look at when trying to decide what to do, whether we need to mostly talk about skincare or if it's more a procedure that you might have in mind. And we'll also talk about how to maintain your skin, how to protect your investment, and also the sequence of events because there sometimes is an optimal procedure sequence. So I guess, right. Wrinkles and rough, discolored skin were kind of the top issues among people. And as we age, we will also see volume loss. We lose a tablespoon of volume in our face every year, and that appears as flattened cheeks, and that starts to happen in our 30s and 40s. We may notice hollow around the eyes, droopy eyelids, hair loss, thinning hair, and vessels that were never there before on our face, on our legs, just being rosier than usual. But a thing that people complain a lot about is the jowls, and that is caused by bony loss here in the prejowl sulcus as well as gravity. So the fat pads that used to be here are descending with time. And as we lose the structure, the bony structure, then the drape of our skin starts to feel flat and develop wrinkles. And we also start to develop fat in places we never had before, such as under our chin, and that's partly gravity. We also have changes and have fat pockets on our abdomen and other places that maybe never were there before. So I want to kind of motivate this talk and talk about why you would choose someone like myself, a dermatologist, to help you with this journey. So dermatology is a core specialty for aesthetics. There are so many med spas out there that are run by OBGYN or pediatrics or internal medicine, and that's perfectly fine. I will say that dermatologists are the ones that have had the most training in terms of your skin health, as well as the hair and the nails. So we are the experts, and therefore we have the most training and knowledge regarding medical, injectable, lasers, as well as surgical options for you. So I don't just have one hammer, I have a whole toolkit that can help you achieve your goals based on your particular needs. And that's the whole point in seeing an expert because you want to be intentional about your treatment plan. And that's what we do together. We can even start with skincare. And if you have conditions such as dry skin, acne, pigmentation, redness, we can really get to a good place with skincare. And then the wrinkles and all those other things, if you are patient, there's a lot you can do with just skincare alone. We can even grow hair now. We have Latisse, we have ultrasound treatments to grow hair, we have lasers for vessels, we have lots of injectable solutions and surgical solutions for things like droopy eyelids, earlobes that are kind of sagging. We have growths that you want to remove, and we can also even do threads under local anesthetic that are FDA cleared for 2 years. So they're longer lasting, not quite a facelift. But if that's something you're not planning on doing, then that is a good option. And we'll also talk a little bit about skin tightening and fat reduction. So skin rejuvenation really starts with what you put on your skin. And you can be spending all sorts of money at Sephora or Nordstrom or whatever TikTok shop may be selling you products. But what you want to look for are the ingredients. And I do like to recommend ingredients that have data and science behind them. And so this list is kind of a representative recommendation of what we usually like to tell patients actually works for them. Vitamin C, antioxidants, lightening creams, retinoids, hyaluronic acid, and we can go into much more detail once we have a face-to-face assessment. You can also book a facial with our esthetician, and they can evaluate your skin and give you a customized treatment plan based on what you need. And you can also have acne extractions along the way. So the thing I tell every patient is prevention is always a lot easier than trying to reverse damage. And so sunscreen every 2 hours. If people ask me at a cocktail party, what's the one thing I can do? That's what I tell them. Most people know about sunscreen, but they don't know to reapply it, even in the shade, even in the winter. As long as you're outside or driving, I have sunscreen. It's a good idea to keep it around all the time. And I also really talk about prepping the skin for a procedure if you come in for a consultation for a resurfacing, for instance, or any laser treatment and you have darker skin tones. We want to optimize your results and minimize any potential risks. And then also post-treatment care so that we can heal quickly and schedule maintenance, routine self-care with facials, which is really microdermabrasion, not just like things being rubbed on your face. And the microneedling is another option. I wanted to show this photo because this patient basically only did skincare and medication. So we saw 3 months of being very diligent with the sun protection, and she got some amazing results. This is a chemical peel, so nothing injected. We will walk you through that as an option if you have something like melasma. I don't jump to lasers usually for melasma because it is a tricky chronic condition. Again, this patient had really nice results with just skincare alone, vitamin C in the morning, hydroquinone at night, and sunscreen. So we did discuss Diamond Glow facials, and this is really nice if you have an event coming up, you have no downtime, you just a little pink for an hour or so, and you can really get that top layer of skin off, and we can customize it based on your concerns if you're more acneic or if you have more pigmentation. So you basically have radiance after the procedure because there are serums that are proprietary to Allergan, which has Diamond Glow. And Allergan's the maker of Botox and Juvederm. So they're the ones that have this device also. And it stimulates healthy skin renewal. And it's relaxing. So there's really no pain. And you can see with repeated treatments, you can really get some nice rejuvenation. This is 10 weeks, 16 weeks. And for more mature skin, microneedling is a good option because it essentially stimulates little skin growth within little tiny poke holes. Obviously, you get numbing cream ahead of time. And with PRFM, which is actually platelet-rich plasma, then that is infused after the microneedling, those growth factors are basically increasing your collagen and your skin renewal. And that can actually be injected also in the hollows of the eyes and around the mouth. But microneedling can really help with acne scars. And it's kind of a slower process, but if you're patient, it's very tolerable in terms of discomfort. And if you have a scar, for instance, we can do dermabrasion and improve that. You just have to put up with being a little pink for a few months. And if you have insurance and you have a lot of sun damage, you can even get a chemical peel covered because it does help field damage that occurs from living in Southern California or sunny climates and not wearing sunscreen. So we do a Jesner TCA 35%, which is a medium depth peel. You have to avoid retinoids ahead of time, and you definitely peel like a snake. You will have 7 to 10 days of just peeling. And I like to prep patients by having a barrier cream ready for them, as well as really cautioning them with sunscreen right afterwards. This is a patient that came in on day 4 because she was alarmed with the peel, but this is 100% normal. And you can see by day 10, her skin was looking good. And not only were her precancers improved, she got some nice collagen stimulation. And so we can consider that if you have medical insurance. These are other things that insurance can help you with. If you have pigmentary changes, any irritated bleeding spots can be removed and tested. So I can do this as a regular medical visit. You don't have to schedule more time. I do biopsies and removals in delicate areas. I removed that hydrocystoma. It was luckily not a skin cancer. And on the other picture, I removed 2 spots on the face. The one on the nose is actually shaven, scraped off, and the one on the cheek, we actually put 1 stitch, which was removed. And you can see they heal very well, but we need to select the right method for the right concern. This was actually removed with a procedure that we did under local anesthetic also. And you can see it healed beautifully. The lips are one of the places that healed among the best. We can also use electrocautery to melt certain superficial epidermal lesions like this. We pre-treated this patient having darker skin types before and after the procedure, and he was very pleased. This was a shave removal in combination with electrocautery. That spot on the tip of the nose is a hard place to treat because obviously it can overshoot or undershoot, but it never came back, so that was nice. It can always come back, but we try our best to prevent that. So a lot of patients get bruising from procedures like this or injectable procedures that we're going to discuss later. So as we age, our skin thins and we can treat thinning skin with arnica cream. And we carry this in the office. So if you have a medical procedure or a cosmetic procedure, it is medical grade arnica that can help reduce the duration of the scar. And we also carry pills that you can take in the office. It's a combination arnica and bromelain. Those are basically dandelion root and pineapple extract that can really help prevent bruising. You want to definitely stop blood thinners ahead of time. Vitamin E, fish oil, aspirin, ibuprofen, and alcohol. Those are offenders. And aspirin's the worst one. I would recommend you stop that for 10 days if it's okay by your physician. So redness is actually the main complaint for younger women. And so I have this slide to show you the different ways redness can show up. On the bottom picture, that's rhinophyma, that's end stage rosacea. So that would be a surgical fix or a laser fix. But the other ones are laser fixes or device fixes. So you can do some topical treatments. This is a really great serum that harnesses the botanicals. So no steroids, it calms, it comforts the skin, and it can mask the redness and over time improve your skin tone and texture. Other ingredients you want to look for, which we carry in our office, are listed below. But of course, again, sunscreen that has zinc or titanium dioxide physical blockers every 2 hours. I'm very excited to announce the purchase of Alma Veil. We have had the need for a vascular laser for quite some time, and we used to rent a V-beam back when we were Huntington Dermatology, and that helped patients a lot. But having this device in our practice all the time is going to be a game changer because almost everyone I know has some sort of facial redness. I do. I had this treatment myself, and I was shocked at how little discomfort there was. I'm glad I waited until now. This is new technology that has contact cooling, and so it's much more comfortable than the old V-beam I used to use. All my old practices had a V-beam, and it was great, but it also hurt, and patients were uncomfortable. So I'm excited that we can offer this treatment to treat acne scars. It can even treat bruises, little small areas of hair removal, and birthmarks, venous flakes on the lip, cherry hemangiomas, those little red moles some people hate, leg vessels, little dilated blood vessels. So these are all treatments that we can do with no numbing and minimal downtime, a little swelling. And it really is a sniper gun for the blood vessels. It is like focused in on that wavelength versus IPL, which we've had in our office. And I do love, we'll show you some photos. IPL is kind of like a machine gun. It treats reds and browns. It kind of treats everything. But this laser is really geared for vessels. And in studies, it was superior or equivalent to V-beam or XLV, which are the standard best treatments on the market before. I feel this one is going to be better for our patients who have darker skin types. So these are the kinds of conditions I would want to treat with the vascular laser. And I know a lot of people hate their blood vessels. Okay, so Lumecca is what we have had in our practice for about 5 years now. And it's great because they're two wavelengths and safe for different skin types. So 515 for lighter patients and red vessels, 580 for darker patients and darker bluer vessels. It really can give you that wow factor. It's a great first treatment for someone to try because you can get dramatic results. And this device is stronger than your typical Medi-Spa IPL lunchtime laser. They'll usually quote you 5 to 7 sessions to get the results I feel like we can give you in 1 to 3. And I'll show you some photos of that. This patient had one procedure with me and she came back a year later. And I was shocked that her results were so durable. And I had fully expected for her to get a second treatment, but she was happy. She maintained her results with skincare. And that was the last treatment she had from this device. This is the blood vessel result that I got with IPL, which is our Lumecca device. It did work, but I will say it hurt. So I'm hoping with the new device it'll be a lot less painful. It's really great for browns among Asian skin types. I wanted us to get this procedure in our office because my mom came in. This is not my mom, but my mom came in and all our freckles were gone in one treatment. So this was one treatment. We did pre-treat with hydroquinone. Another patient that had pre-treatment with hydroquinone, she came back for a second treatment because as you can see, that lower growth is a little thicker. And so that second treatment did help remove that. And again, another picture of the sun damage. This was also one treatment. This patient had some significant peeling, like very, very dark. We did have him medicated at the time because he had a separate procedure. So he got really great results with just one treatment. Again, one treatment. It does not treat melasma. We'll talk about that. Even darker skin types can benefit. You might want to go a little slower. This person had three. And so we have a very strict protocol. I like to meet you ahead of time. I like to prescribe medications, make sure you don't have any history of cold sores. Otherwise, Valtrex is necessary. I advise you to come early because I want it to be comfortable. Usually, patients say it's 2 to 4 out of 10 pain. It's a very, very bright light, like a photocopier. That's what's startling for patients. We do give you an eye shield. And then we also encourage you not to pick because if you pick the spots before they're ready to fall off, they will scar. So that's why it's so critical for us to pre-treat you and have barrier creams ready to go. And so that's the episerum you see on the bottom. That's a prescription. We do offer barrier creams with growth factors that can speed up the healing. That's a bit pricier than the episerum. And the episerum is nice because it's a large quantity for about $50 that you get directly from the pharmacy. And again, I really don't treat melasma with Lumecca. I do recommend Hollywood Spectra. So that's the device we required about 2 years ago. And Sharonda Longino in our office is the expert for this procedure. It is multiple procedures because melasma is a chronic condition. And we do recommend every 2 or 3 weeks. You don't need any topical numbing. It doesn't hurt. It's very easy, very well tolerated. And again, this was 7 treatments. Several treatments necessary to get complete clearance, and then also good skincare to maintain. The nice thing about this procedure is you can actually treat active acne, active melasma, and treat the pigment from it. So you can treat acne scars, you can do resurfacing. It's safe for all skin types. It's really, truly colorblind. You can just get a laser facial and pull out all the little blackheads. You can see really nice results with very happy teenagers. Even old scars are looking really good. Um, this was one treatment. You can do chest, back, acne, and it can even treat tattoos with a different handpiece. So it's a different handpiece. You can treat all colors of tattoos, reds, purples, and it is multiple sessions. I do recommend you come in for a consultation. But if you are ready to book, we have you come in early for numbing and we will inject numbing for the tattoo because that's the one mode that is a bit more uncomfortable. The other treatments, the active acne, melasma, red carpet facial, they're really great. It's a quick procedure, no numbing, barely any downtime, a little pink. Darker patients, I would recommend hydroquinone for any device. Okay, I'm really excited also about Ultra Clear. I have a whole separate webinar dedicated to this device, which we introduced in January, February of this year. So if you are interested to learn more, it's on our website. And just a quick overview, it can really dial in the different layers of skin, epidermis, dermis, and deeper dermis. So depending on your specific needs and your level of downtime risk, you can get some amazing results. So this patient had already had, she actually, this is her baseline photo, but she went through 2 ultra clear lights, which is a little bit deeper than 3D Miracle. So 3D Miracle is the proprietary trademarked name, which is only the epidermis. So this went a little bit deeper to address some of her pigmentary concerns. But since she had melasma at baseline, you have to be very cautious. This is her second treatment. So she volunteered to take selfies and share with patients her journey. Um, on the first day, you feel like you have a sunburn. I recommend you do vinegar soaks. We provide you a Epicutis lipid mask that you go home with. And we recommend you use TNS ceramides, which has growth factors, and a barrier cream. Day two, you're starting to get a grid-like resurfacing, which is basically that top layer of skin sloughing off. You have to reapply sunscreen every 2 hours. So after 24 hours, you're welcome to wear makeup, but you cannot pick these spots off. If you pick them off, again, you can have some bad consequences. So you want to avoid being outside, avoid scratching, avoid direct sunlight. And then by day five, she didn't wear makeup in any of these photos, and she just had a few dark flakes. And at this point, you can resume your retinoids, your actives, your vitamin C's. And then by day six, her skin's glowing, and her friends are now asking her, "What are you doing? Because your skin is looking amazing." And so she's very pleased. She did 2 treatments, and then she got really good results before and after. It's just 2 weeks after her second treatment. Okay, so this is medium depth. So a lot of times people want to know, should I do light or should I do medium? So if you are interested in collagen stimulation for sagging or wrinkles, this is the way to go because it's not just the surface layer, it's actually getting to where the collagen is, lost over time. So it's not a big price differential, it's more the downtime. So you're not supposed to wear makeup or sunscreen for technically 72 hours. And the main reason for that is infection. But I will tell you, I had medium treatment and I used brand new products, and it was the day before Thanksgiving, so I had to do something. So I put something on and I was fine. But I am a dermatologist, so I would recommend you just follow our instructions. She did go to Disneyland on day 2 or 3. She was really good with her mask and her hat and her sunglasses. And so by day 4, after Disneyland, she was actually just fine. This is an example of medium treatment around the eyes. Really fast results. Usually it takes 6 to 12 weeks to start seeing collagen building. And this is medium, but the patient forgot to stop blood thinners. Early on, we didn't realize how much pinpoint bleeding you can get with the older we are. So we now advise patients to hold blood thinners if possible. But it doesn't matter because even though she didn't hold blood thinners, she healed beautifully. And by day 7 or 8, she was actually looking fabulous. So that's each daily progression of her healing. And I think she got really tremendous results. So you can't really mess it up as long as you stay inside. So you can do it right around the eyelid. We can use an eye shield and treat right to the lash line. And interestingly, patients are getting collagen and not needing to raise their eyebrows as high afterwards. So this is a medium treatment, but almost like she got a mini eyelid lift, because she's not needing to raise her eyebrows as much to see. This patient combines Spectra and Ultra Clear for help with his acne scars. So that is this photo. Same with here. We had Spectra longer, so we've been using Spectra. She had 4 Spectra treatments and 1 Ultra Clear medium treatment. Very happy. This patient did 1 medium treatment, and this was a few weeks later, a selfie in natural light, and then in the clinic, side by side, just with 1 treatment. This is pretty incredible. I did a lot of Fraxel in my other practice, and even after 5 sessions of pretty painful $1,000 treatments, people were not getting the results. And I was blown away that this patient, after 3 days, had recovered to this extent. This is a different patient that had ice pick scars. I couldn't believe that after 3 days, it was already basically healed. He did have some pinpoint bleeding initially. So this is 3 days after the procedure. Just a little dry, a little pink. This is another medium treatment on a darker patient who was concerned with her acne and acne scars. But you can see it really helped her pores, her texture. You're not supposed to do ultra clear with active acne, but it didn't flare her. We have a protocol in place. And then following her treatment, or 1 treatment of medium, she's going to get on an acne skincare regimen. And she's very happy. She did not use any lightening cream, although that is what I would normally recommend. So going on to more strong treatments, again, I was just blown away at how quickly people recover from this resurfacing device that normally takes 6 weeks with CO2, for instance. You do look a little scary for the first 2 or 3 days, and this coring procedure is actually removing bits of skin. So kind of like Swiss cheese that's removing the holes, you have less cheese, so everything kind of cinches up. And he lived in Hawaii. So by day 4, he's happily in Hawaii doing a selfie with sunscreen on. But he just wanted to show me how quickly he recovered. So this is day 1, day 2, coring, day 3. And then, by day 4, you still see a little bit of the coring grids, but healing quickly. So younger patients also want to stimulate collagen. This is a 40-year-old who did coring of the face and neck, and she used growth factors as well as like Epicutis mask, and she really knows how to take care of her skin. So by day 4, she was back to work. A little swelling that we control with prednisone, doxycycline to reduce inflammation. Valtrex is sometimes given if you have a history of cold sores. Tianoceramide is the one with the growth factors. These are the treatment recommendations. Our protocol is really dialed in now, and we give you reminders on how to apply and use everything. But I always like to meet you ahead of time so we can kind of go through this process and give you your prescriptions. The grid-like marks can remain for a few weeks. This is day 4. And if you were to look or touch and feel, it can still be there, 1 to 4 weeks later. Not ugly, but definitely want to just be aware that they can linger longer, but you're getting almost like a mini lift because the laser is cutting out bits of skin. So this patient did not do vinegar soaks. So I just wanted to show you why they're so critical. If you can do vinegar soaks, it can help clean and prevent that honey colored crust. But by day 8, she was happy and her skin is glowing. And she did move out of town, but these are her initial results for acne scarring. And remember, it takes about 6 to 12 months to see final results. This is 6-week results for coring just around the lips. And so this patient just wore a surgical mask while she was recovering. And all we did was core around her mouth. We didn't do much of anything else. She was pretty happy with just one procedure. So I have the follow-up pictures for this patient that I presented in the other webinar. And again, day 3 are her lower left photos down there. She has some makeup on and she's seeing clients on day 3. So 72 hours later, she was back to work. On the top right photo, you can see just 1 week results. But interestingly, it took a little time for us to get the collagen stimulation. So this is her 6-week results on the bottom right. And we did coring only around her mouth, but we did treat her face and neck. Only one treatment. And so she's extremely happy. Another follow-up for those little accordion lines. Got some skin tightening, still early, 6-week results. If you look very, very closely, I do core a little bit more strong underneath the chin area, but you can barely see it. It's kind of covered up. She's getting some pigmentation. She had a CO2 laser decades ago around her mouth, which caused whitening. So this did help repigment a little bit, and we're still seeing results. Darker skin types are totally safe. I will do a test spot for coring under the chin, and if you don't have any issues, then we can do coring. So that's why she had a medium treatment first and then coring second, and really nice lift. This patient was getting ready for a wedding, a family member, and so she wanted something that would work quickly and minimal downtime. And this was 3 weeks after the treatment, face and neck coring around the mouth and lower face, and she got some really nice improvement and will only continue to improve. So very happy, and maybe we'll do another procedure of some other kind in the future. So this is the chest. So it's very safe to do this procedure off the face and neck. A lot of people don't like those little grids, those little chest wrinkles. And if you see, she actually got improvement of a precancer in the middle. It did treat that. Okay, so this is just to show you we can combine treatments. So this patient had 3 Lumecca treatments and then 1 Ultra Clear. Very happy. This treatment was actually at the same time. I did Lumecca and Ultra Clear on the same day, and nice nice peeling, nice lifting of the eyelids. This is also combination same day Lumecca for the spots, but then nice to have ultra clear to stimulate collagen. And you will see that there are grid lines. The more pigment you have, the more obvious it will be as you're healing. And your kids will ask you what you did. But you can wear makeup for a light treatment. And this is looking at the blood vessel. We did a little electrocautery to treat the hemangioma. This is before we had the veil laser. And then in the middle photo is after we also did one Lumecca. And then the right photo is after ultra clear. So you can definitely combine treatments and do them spaced apart. You can see her progression of her healing. And by day 4 or 5, she's looking really good. Most of the sloughing is gone. And I'm just going to switch gears very briefly to leg veins. I just wanted to point out that we do offer sclerotherapy in our office. These leg veins are caused by floppy vessels that basically push the veins, have valves that push blood up. And as they get floppy with time, they can get engorged. And so once they are thick, like the one on the right, we have to refer you for a procedure such as a vascular surgeon or interventional radiologist. But if you look more like the left photo, that's going to be a sclerotherapy or a vascular laser. So this is my husband, William Lee. He and I share a few patients, but he would be the kind of person that would treat you. I refer most of my patients to the USC group that practices out of USC Huntington, Arcadia, and Verdugo. So you can see him or Dr. Yagmai for more cosmetic concerns. This is just to show you what can happen after sclera. You can definitely get some bruising. I tell patients you can look worse for 6 weeks before you get better. Um, and let's switch gears a little bit now to hair loss. We are the experts in hair, skin, and nails, so I invite you to use your insurance because it is a medical condition and get a diagnosis. We can do a biopsy, but usually we don't need to. And if you have proper nutrition, we can sometimes improve your vitamins to help with hair growth, prescribe medications if you're willing, do Kenalog injections if you've an autoimmune cause for hair loss. We also have been offering PRP, which is the same drawing the blood, spinning it down, and injecting it into the scalp. But a lot of patients felt like that was painful. So now we offer TED, which is one of the more recent innovations, and it uses ultrasound. Obviously, you can get hair transplantation, which is going to run you more like $10,000 to $20,000. These are results for PRP. It's usually about 4 to 5 sessions. You can definitely get results. That's why we offered it in our office. But again, people were kind of needle phobic. And this is an injection result that can happen from alopecia areata. A different office injected this patient's scalp, and you can get a little bit of atrophy, which went away after we took over her care. And after I started doing the injections and other treatments, she got really nice full hair. You can also have both autoimmune alopecia as well as androgenic alopecia, which is due to getting older, the androgen hormones. So male pattern baldness can usually typically occur on the top of the head, but women can get it in the front. So Almated is this revolutionary new treatment that uses ultrasound to shake the cells and create gaps and allow the medication with air pressure and ultrasound to drive in this proprietary hair serum that was developed in Italy. It's been over 30 years of research that is mostly growth factors to stimulate vascularity to deliver the nutrition that's necessary for the hair to grow back thicker and often darker. So the beautiful thing is there are no needles, there's no pain, there's no numbing, and there's no downtime. So you just have to come with clean hair, no product, and you can't wash it for 24 hours. You can take a bath and shower, but you just can't get your scalp wet. And it's really great. Most patients will do at least 3 sessions. 95% of patients in the study got improvement after 3 sessions. So that's why we recommend 3. If you have significant hair loss, you might need 4 or 5 to really be happy. But then usually the results are durable for at least a year. We do recommend considering a follow-up, and we can always do more treatments. They're totally safe. But we are now seeing patients wanting rejuvenation, hair restoration without needles. So that's why I acquired this for our office. A lot of patients were losing hair from COVID and stress. And it's just, it can really age us. So shedding can be very traumatic for people who see clumps of hair. And if we can do something about it, why not? Off label, we can also treat eyebrows. It's not a standalone treatment, but we can add that on if you want to treat your scalp. Latisse is another way to grow hair for eyelashes. It is safe for blue-eyed patients. You just can't put the medication as an eyedropper into the eyeball. There have been no reports of patients who have used Latisse for eyelash growth having changes in their eye color. So I've done this treatment before my wedding. And then once you're happy with the growth, you can space it out to a few times a week. But it does take a few weeks to see the results. I use this treatment today, and this is great for those who want a little eyelid lift and who want the whites of their eyes a little whiter. And it basically lifts the lids without surgery or Botox. These are my photos from before our wedding. That's why I have a little sparkly makeup on the bottom, but it really does help you look more awake. I do love doing upper eyelid blepharoplasty. This is my favorite procedure to do because it takes 45 minutes and we help you look less tired. But we don't want you to look like you've had your eyelids actually done. So very natural results. We hide the scar in the crease of the eyelid. These are immediately after we stitch it up. And the scar does extend a little bit to the side, but at day 6, we take out the sutures. You can wear sunglasses. And by 4 or 6 weeks, you're looking pretty good. But interestingly, you continue to improve up to 6 months to 12 months. This is immediately after she was on ibuprofen. So I brought her back 2 weeks later to recheck, and she had fully recovered. Very natural. You just look nicer, happier, more alert. And then I also showed what the scar looks like with the eyes closed, and very happy, very natural. I did Mohs surgery the same day on this patient, so he has 2 scars. And then again, if you're constantly using your eyebrows to just see at rest, you're not a great candidate for Botox. And this patient didn't have Botox, she just had the eyelid lift. And after the little bit of bruising, by 6 weeks, she had no longer the need to raise her eyebrows so much, so it was much more smooth. Asymmetry is a frequent complaint I see among younger patients. He barely had any bruising in the middle. That's the day of suture removal, and at 6 weeks looking great. This person combined treatment with IPL. I mean, she figured she's already out of commission, so why not get a little Botofacial at the same time? And again, the scars are not very visible. We do recommend scar gel, silicone gel, and sunglasses. Every ethnic group can benefit as long as you have a crease. I can take care of it under local anesthetic. Very predictable results. Okay, so just a quick pause because I want to talk about the order of events on when you do things. You notice I haven't even talked about Botox and fillers yet because I feel like a lot of people know things about injectables already. So I wanted to show you that if we can resurface and build a good foundation to begin with, then we can maintain the results with Botox and injectables. But you can really reset your skin by doing a procedure and treating those age-defining features. So we offer in our clinic all these procedures. It's a really long list, and I don't mean to overwhelm you or confuse you. That's why I invite you to consider meeting with me in person. If you're a patient, existing patient, we can discuss all your concerns and specifically tailor what is the most important to you today and create a timeline, a care plan for you because we're just learning here. We're just dipping our toe in. But Botox is often the first treatment most people will try. I started when I was in my 30s, and I think that it would help prevent a lot of the wrinkles that would normally be present 15 years later. And it does last about 3 to 4 months. Certain products may purport to last 5 or 6 months, but essentially what we're doing is training ourselves not to overexpress. You still have expression, Um, we can treat all these muscle groups and prevent ourselves from looking angry all the time and fixed resting angry face. And then, because once the wrinkles are fixed at rest, we then need to do an injectable, like a filler or a resurfacing procedure. Men have bigger muscles and sometimes prefer Dysport, which can spread a bit more. I personally um, have used almost all the different types, and it's kind of the difference between Coke and Pepsi. Like if you start with Coke, you're gonna like Coke, and I specifically like Diet Coke, so I like baby Botox. But you can do Botox in all different areas um, of the face. And this is an example of gummy smile. Oh, interestingly, I just want to point out, I forgot to mention, you can do it for masseters. I grind my teeth, and that's a great treatment to help the bulkiness. Some people do it just for aesthetics. This is on label now. Actually, this slide is a little old. It just became on label for the neck bands. You can do lip flip, so have more lip show. Okay, so just briefly about fillers. There are two main categories. One is hyaluronic acid. That's a substance your body naturally makes, and therefore there's an eraser for it. So it doesn't last forever, but if you hate it, you can erase it. The second main category would be like a collagen stimulator. So Sculptra is something that's getting a lot of traction now on social media for kind of glow because they're stimulating collagen. And that is a great procedure because it's kind of what people do when they have amazing skin, but they don't tell you they do anything. It takes a little time to build, so it's not an overnight change. And the radius is kind of in between some immediate benefit and some long-term benefit. So we pick the filler based on what level of skin we need to treat. For the nasolabial folds, I usually do Juvederm, XC, Volure, can last up to 18 months with 3 syringes. Between the eyebrows is off label, but you would need Botox and a filler to fill that gap once it's at rest. And then the hands are an area people use filler to help not have old lady or old man hands, skeletal hands. Basically, we use a plastic cannula, so it's very safe. This is an example, another example of kind of more plump skin. It's a very easy procedure. We can use a plastic cannula to put filler in the neck and Botox for the bands, and then you can consider resurfacing for pigment. That's what we did here. We did multimodal approach, Radius, Lumecca, Botox, and skincare. You can even put filler in the earlobes when the earlobes are starting to get droopy, or we can repair it. So once the hole is really wide, I can remove it under local, sew it up, and then re-pierce it for you about 6 weeks later. So this is just an example of how you can get really nice earrings that stay in your ear. So this is a busy slide, but just to show you that we pick different types of filler, like Voluma for the cheeks, because it's more like shaving cream and it expands. I like to put it in areas where I need volume. Um, so just some photos. Juvederm lasts about 6 to 12 months. This was Restylane Lift and Restylane. This is a younger patient who was looking to fill this nasolabial fold. And she's young, but she had served in the military and had a kid, so I figured she could get filler. A patient with Voluma can really lift multiple areas. She was very thrilled. These are immediate results. This is immediately after injection. And the lower face lift can definitely improve, but usually you'll need about 1 syringe per decade for full correction. Interesting that filler can actually improve the lift. It's just a small amount, 1/5 of a teaspoon for each syringe. So for 4 syringes, she does not look puffy or swollen in any way. In fact, she looks both look thinner and more rested. So this is to show a 45-year-old patient who had 4 Voluma, Juvederm, and RHA because we were addressing the tear trough. And this is over 2 sessions. So she will have very nice durable results. Voluma can last up to 2 years in clinical practice. Volux also can last 2 to 3 years. It's been used in Asia for longer for jawline definition. I use it off-label in the zygoma. So just to show you again, 1 syringe per decade, a couple more photos. Men sometimes need more syringes. You can slim the face. This was in combination with masseter Botox. This person got chin augmentation with filler and lips done. So again, very natural, very tasteful. Um, Juvederm, Botox. And this is Sculptra. So Sculptra is the other class of the biostimulator. It's like planting a tree that grows with time. I typically inject at least 4 because most of my patients are about 40 or 60. So we want to usually inject 2 each session, and I usually do about 2 or 3 sessions. But this is about 11 months after the first injection. So very long lasting because it's your own collagen being stimulated. And it really serves almost like a liquid lift. And it's not perfect because it doesn't treat the little tiny wrinkles around the mouth, but it does really give more volume, especially in the temples. Radius was the one in between. There's some immediate benefit and then some longer lasting collagen stimulation. It can be seen on a plain film if you take an x-ray because it's calcium hydroxyapatite. Restylane was my favorite filler for under the eye. I still do use Restylane there. I now also use Voluma and RHA Redensity. So these are pictures of Restylane for tear trough filler. This is with Botox. She was so happy she took a selfie to show me. It can really treat the hollows. Of course, you can get some bruising, but tends to last longer here because it's not like you're moving this area that much, about a year or more. This patient had both upper eyelid blepharoplasty with me as about 4 years ago, actually, and tear trough filler more recently. So I had a follow-up photo to show you that her upper eyelid results were durable and really happy with tear trough filler. You can see festoons. It's kind of this is a very hard condition to treat. So we initially addressed it by correcting the mid face by doing some filler, as well as some filler around the mouth. And then we did ultra clear. So we did an eye shield and did some coring around the eyes. And this was 1 month later. He said that it took about a week to recover. So even after just 1 treatment, I was very happy that he got improvement and came back for 2 more. This is after the second treatment. I don't have his third treatment results yet, but we addressed the volume, the wrinkles, and also helped that little festoon. And that's a very hard problem to solve. Okay, so lips are my other favorite treatment. I'm just going to blow through these slides because I want to leave time for a question and answer, but just to show you can look very natural with filler. These are just more filler pictures before and afters. You want to avoid blood thinners. We often combine different treatments. This is acne with red laser. This is subcision. Subcision is an acne treatment where we actually pop up the scar. And this was ultra clear with subcision, so darker skin type still with just 1 treatment. We can often treat resurfacing for skin tone and then do filler later. So we help the skin tone with the laser and then filler for the volume. This patient did upper and lower upper bleph, sorry, as well as IPL, and then came back for ultra clear. So you can spread out your procedures too. Morpheus is for those who want very, very little downtime. I don't perform this procedure. We do have it in our office. Shonda does it. I just feel like you need multiple sessions. And so I would like things that work a little more quickly. Instalift is great for lifting. This is the procedure that's FDA clear for 2 years. Basically, threads are placed and cinched up. You can get some swelling, but you can get some nice results within a month. Some bruising that can occur in about a week, but you can cover with makeup. Again, 1 month after thread lift, 2 weeks after thread lift, really fast. Can help the neck, but what really astounded me was that it helped the bags under the eyes. And then one last quick shout out to Cell Sound. This is the painless, no numbing, no downtime fat removal, which can treat visceral fat. So this is before GLPs. Even after GLPs, people have skin tightening issues, and it can treat and build collagen with 0 downtime. This was a combination, Morpheus and Cell Sound for some cellulite. And then there are electrodes that are placed on one side, and the fat treatment is stimulated on the other. And the face kind of contracts. So it feels weird, but there's no pain. This is 2 treatments of Cell Sound, the fat pockets, and sharpened jawline. And that's it. We really recommend 3 treatments. I did kind of rush toward the end, but we always have time to chat. This is our practice. Dr. Baccaro is retiring, and we have Dr. Davigi joining us. in September. Dr. Devolio is working and has been working side by side with me for the past 3 years and continues to work much longer. We have Sharonda Longino, who's our expert in acne and hair. Jeannie loves acne, rashes, skin checks, and is going to be the vascular laser provider, as well as Dr. Liu, who's enrolling for clinical trials. So if you have atopic dermatitis or spontaneous urticaria, we are enrolling for clinical trials. And as a thank you, we are offering a webinar promotion. So booking with the code word LuxGlow, you'll get 10% off any packages. Plus, you can get $100 off our Lux List loyalty program and $50 off any first treatment while supplies last. So please call and book. For the Lux List, it's basically just our VIP membership program. And sorry, I didn't leave much time for questions.
Nope, that's totally fine. I just popped the instructions on how to claim this promotion into the chat. So you guys all have that there. You can either call or text. If you're calling tonight, we'll get back to you first thing tomorrow morning. You can also just email us, but keep that code word handy because you're going to need that in order to get the promotion. All right, so we do have a few moments left for some Q&A. So let me see what we have here in the questions and answers. And again, if you guys have any lingering questions from that fantastic presentation, pop them right in right now because we'll go ahead and get started on a couple of these. Let's see. First question coming in. Can I use patient financing for each of these treatments?
Absolutely. So we offer cherry, so that's interest-free for 6 months.
Awesome. Fantastic. How about the consultation process? Is there a consultation fee or do we do any virtual consults?
So we definitely recommend you come in person because then we can really look at your skin. We do have a fee if you want to meet with me. There's also a slightly lower fee to meet with Sharonda Longino. But we are offering just staff consults where you can submit a photo to our office and then you'll meet in person with our staff and we will have looked at it ahead of time and offer you some recommendations. And that's free of charge.
Fantastic. Let's see. Is it possible to do lasers during sunny months? Hard to avoid the sun living in Southern California.
Yeah, so because it's basically summer all year round, I've never been afraid of doing procedures. We have a really great protocol. You just have to be really good about sunscreen. So I won't treat you until you and I have a conversation. I can be sure that you're going to be safe.
Fantastic. Dr. Chan, what treatment plans do you follow?
Okay, so I'm pretty religious about my sunscreen, as I told you. I do vitamin C in the morning. I definitely love peptides. I've been using the eye cream that we carry in our office for 15 years. That's like a no-brainer for me. I have to use that. But can't be bothered to do too much all the time. So I like the treatments we have that are kind of combination products, as well as I do use hydroquinone. I think it's safe as long as you're not pregnant or breastfeeding for brown spots. And also that preps me so that when I do a procedure, I don't have to worry about issues. And I really think that my philosophy is I can't be bothered to do things like a red light mask I don't do any of that. I just go and get a procedure. So whether that's Botox, fillers, the ultrasound treatment, I've tried almost all these microneedling. I've basically done it all. And so I found that the ultra clear procedure I did kind of pushed off my need for filler. So I really have been surprised with that.
Fantastic. All right, got another one in here. I'm in my 50s looking for non-surgical skin rejuvenation. What's the longest lasting treatment option for me?
So I think that laser coring procedure can really erase a lot of those wrinkles that are at rest. So I don't know if you're a 50-year-old who, has had a lot of sun, like tennis, or if you're the 50-year-old who has been like me, I'm almost 50. And so it really depends on your skin type. But I think that a laser resurfacing procedure can give you the most durable results. Sculptra is great because it can last 2 to 7 years. Voluma, again, 2 years. I think Botox is kind of necessary because it trains us not to over express and make those wrinkles.
Let's see, another one just popped in. Have you done threads?
I have performed threads on many people, including my mother. I have not personally done threads because I don't think I need it quite yet. Um, I wouldn't hesitate to do it if I thought it was necessary. So when you start to get the like jowl down here, I really sometimes just really want to just put two threads right there. So I think it's very safe, very doable. Um, right now in the office, I'm the one performing most of them. So until I need them, I probably won't be looking outside the office for it.
How much does an ultra clear coring procedure cost?
So it really depends on how much we core, because if we just do the mouth, it I think is very affordable. Also, we really like to look at your skin and get a package or get like a treatment plan for you. So depending on how many areas we treat, how many times we do it, we can really customize a package. But it's similar to like a few fillers. So, I mean, it's not out of the realm of, what's accessible. I think that resurfacing procedures in general can be a few $1,000s. So, you're getting amazing results with coring because it's even better than resurfacing, I would say.
And you can use patient financing.
And you can use patient financing.
Let's see. I think we have enough time for maybe one more question. How much does the threading procedures cost?
Yeah, so again, it depends on how many threads. So we have kind of entry level, depending if we just do two on each side. Again, very similar to a couple syringes of filler. But if we do like five on each side, that's going to be more looking like a resurfacing, like a big multi-step resurfacing procedure. So we do have the ability to look at your skin and combine treatment options and give you some sort of package pricing or a customized treatment plan. So I don't remember prices off the top of my head, but it's similar to several filler, I would say.
Awesome. Perfect. Well, I think that's all for questions. I did see one person had a question about what is the code word. The code word again is Lux Glow. So feel free to call, text, or send us an email and get yourself in line for the membership package. Thanks everybody for joining. Thank you, Dr. Chan, for that fantastic webinar. We will be sending out the recording to everybody here as well, so you'll have that handy. And I do also want to just put in a little bit of a plug of a save the date for Wednesday, August 20th for our summer soiree. So I'll make sure that everybody here is on the email list so that you can get some more information about that. But we're super excited to have everybody come in and check out the practice, and we can give you a little bit more of more information about some of these procedures.
Thanks so much for making it to the end. See you soon.